Okay, let's start with reviewing what an ASD waveform is. The A wave is a normal retrograde wave that is seen above the baseline, and this results from right atrial contraction that leads to reflux of blood in the IVC, the SVC, and the hepatic veins. And the reason this occurs is because there are no valves to stop that from happening when the right atrium contracts. The S wave is visualized usually as a large pulse waveform that's below the baseline, and this corresponds to ventricular systole. The ventricle squeezing, the tricuspid valve is shut, and it's the rapid filling phase of the atrium. And the D wave corresponds to ventricular diastole. It's the second forward flow waveform. That usually results because there is a diminished pressure in the right atrium when the tricuspid valve opens again. Okay, so let me kind of explain that. What causes all of that? Well, let's look here at the PowerPoint. Let's start with the A wave. So what causes this A wave reversal? Well, first of all, the atrium contracts, and the atrial pressure ranges from 0 to 25, okay? And because there's a range of pressure, the high pressure is when the atrium is actually contracting. So that's when it reaches its high pressure. So when the atrium is contracting, atrial pressure is 25, the high pressure. The hepatic veins on average are about 15 millimeters of mercury. So when you calculate out a pressure gradient, if P1, being at the right atrium, is 25 and P2, located at the hepatic vein, is 15, the difference is 10. And then blood moves from an area of high to low. So blood is going to move, in this case, out, back into the IVC, back into the SVC, as a result of atrial pressure increasing to 25. That's what causes this little bit of reversal, okay? And if the pressure gradient is proportional to volume flow, you're going to get a small reversal of A wave. And why does this actually happen? Because there are no valves to stop that from happening. Okay, so right after the atrium contracts, it's going to open back up, and then the pressure within the atrium is going to be 0. Okay, so in the atrium, right as it opens back up, the pressure is 0. All the blood in the ventricle now is going to squeeze, and during ventricular systole, the tricuspid valve is shut. The atrium, with a pressure of 0, is now experiencing rapid filling from the SVC, the IVC, and the hepatic veins. So let's go down to scenario 2. If the hepatic veins are 15 and the right atrium is 0, because the tricuspid valve here is shut and the ventricle is squeezing, blood is rapidly filling up that atrium. So blood is moving again from an area of high to low. So the pressure gradient is 15. And pressure gradient is proportional to volume flow, which results in forward flow, rapid filling, large pulse waveform. Okay, that's during ventricular systole. And then what happens, the third component, let me erase the board again. And let's use purple. Okay, so right after the ventricle stops squeezing and releases all the blood, it's going to open back up. And then pressure in the ventricle is going to be 0. But at the same time, this was rapidly filling during ventricular systole. So pressure was starting to fill up. So it went from 0, and we're going to make up a number, to about 3. As it continues to fill, it goes up and up. But as soon as the pressure in the right atrium exceeds the pressure in the right ventricle, it forces the tricuspid valve open. So at this point, the tricuspid valve is open. So blood is now rushing in from the great vessels, but at the same time, blood is moving into the ventricle. So during ventricular diastole, the D wave, okay, ventricular diastole, both the atrium and the ventricle are filling at the same time. And if you calculate out a pressure gradient, the hepatic veins being 15, and now the right atrium, as it was filling, started to build up, and we just use an example of 3. Okay, the pressure gradient is now 12. The direction is still towards the heart, and then you have what we refer to as the D wave. It's a little bit smaller than the S wave because the pressure is going up as the blood is filling the atrium. So again, if the pressure gradient is proportional to volume flow, that will be reflected in the waveform. So we have the small A wave from atrial contraction, and the fact that there's no valves to stop that from reversing. Then we have the S wave during ventricular systole, which corresponds to the rapid filling phase of the atrium when the pressure drops back down to 0 in the atrium. As that pressure starts to build up and the ventricle now relaxes, the ventricular pressure is 0, right? And the atrium was starting to fill. So we have both atrium and ventricle filling at the same time, resulting in our D wave. Okay, so hopefully that helps to explain why this is an exception to a vein. Any veins that are in close proximity to the heart are going to have ASD waveforms. Most other veins are just going to have phasic flow.